Ozempic has gained significant attention as a potential solution for weight loss. This medication, originally developed to treat type 2 diabetes, has shown promising results in helping individuals shed excess pounds. As obesity rates continue to rise globally, many are turning to Ozempic as a potential aid in their weight loss journey. This video explores what Ozempic is, how it works for weight loss, and its differences from similar medications like Wegovy. It also examines the potential benefits and risks associated with using Ozempic for weight management. By understanding these aspects, readers can gain valuable insights into this revolutionary treatment option and its impact on the field of weight loss management. What is Ozempic? Definition and FDA approval. Ozempic is a prescription medication that has gained attention for its effectiveness in managing type 2 diabetes. The U.S. Food and Drug Administration, FDA, approved Ozempic in 2017 as an injectable drug to help adults with type 2 diabetes improve their blood sugar control. It is important to note that Ozempic is not recommended as a first-line therapy for patients who have inadequate glycemic control through diet and exercise alone. Active ingredient: semaglutide. The active ingredient in Ozempic is semaglutide, a peptide designed to mimic the effects of a naturally occurring gut hormone in humans. Semaglutide belongs to a class of drugs called glucagon-like peptide 1, GLP-1, receptor agonists. This medication works by stimulating the release of insulin from the pancreas in response to food intake, which helps regulate blood glucose levels. Original purpose: type 2 diabetes treatment. Ozempic was originally developed and approved for the treatment of type 2 diabetes. It is used as an adjunct to diet and exercise to improve glycemic control in adults with this condition. The medication has shown promising results in helping patients manage their blood sugar levels effectively. In addition to its primary purpose of controlling blood glucose, Ozempic has demonstrated other potential benefits. Studies have shown that treatment with Ozempic can lead to weight loss, which is considered beneficial for patients with diabetes. Furthermore, Ozempic has been found to reduce the risk of major cardiovascular events such as heart attack, stroke, or death in adults with type 2 diabetes who have known heart disease. It is crucial to understand that while Ozempic has shown effectiveness in weight management, it is not approved by the FDA as a weight loss medication. The drug's primary indication remains the treatment of type 2 diabetes and the reduction of cardiovascular risks in certain patients. Ozempic is available in different dosage forms, including pre-filled pens containing 0.25 mg, 0.5 mg, or 1 mg of semaglutide solution for injection. The starting dose is typically 0.25 mg once a week, which can be increased to 0.5 mg after 4 weeks if needed. In some cases, the dose may be further increased to a maximum of 1 mg once a week. As with any medication, Ozempic has potential side effects and limitations. It is not recommended for use in patients with a history of pancreatitis, and it is not indicated for the treatment of type 1 diabetes or diabetic ketoacidosis. Healthcare providers carefully consider a patient's medical history and individual needs when prescribing Ozempic. How Ozempic works for weight loss. Mimicking natural hormones. Ozempic, with its active ingredient semaglutide, works by mimicking a naturally occurring hormone in the body called glucagon-like peptide 1, GLP-1. This hormone plays a crucial role in managing blood sugar and appetite. Ozempic acts as a GLP-1 receptor agonist, which means it binds to and activates the GLP-1 receptors in the body, similar to the way the natural hormone would. When a person eats, their body normally produces GLP-1 in response to detecting nutrients. This hormone is part of a signaling pathway that informs the body that food has been consumed and prepares it to use the energy from that food. Ozempic essentially amplifies this natural process, leading to several effects that contribute to weight loss. Impact on appetite and digestion. One of the primary ways Ozempic helps with weight loss is by suppressing appetite. By activating GLP-1 receptors, the medication induces a feeling of satiety or fullness, which helps reduce overall food intake. This effect on appetite can be particularly beneficial for individuals who struggle with constant food cravings or what some describe as food noise, the persistent internal urge to eat. Ozempic also has an impact on digestion. It slows down gastric emptying, which is the rate at which food leaves the stomach and enters the intestines. This slower digestion process helps people feel fuller for longer periods after meals, further contributing to reduced calorie intake. Additionally, Ozempic influences the body's insulin production. It stimulates the release of insulin from the pancreas when blood sugar levels rise, while also preventing the release of glucagon, a hormone that raises blood sugar. This dual action helps regulate blood glucose levels, which can be particularly beneficial for individuals with type 2 diabetes who are also trying to lose weight. Comparison to bariatric surgery effects. While Ozempic has shown impressive results in clinical trials, with participants losing an average of 15–20% of their initial body weight, it's important to compare its effects to other weight loss interventions, such as bariatric surgery. Bariatric surgery typically results in more significant weight loss compared to Ozempic, with patients losing about 2–3 times more weight than those taking the medication. However, it's crucial to note that bariatric surgery is a highly invasive procedure with an extended recovery time, whereas Ozempic is a once-weekly injectable medication that can be administered at home. Interestingly, the mechanisms by which Ozempic works share some similarities with the effects of bariatric surgery. Both interventions lead to increased levels of GLP-1 in the body. In the case of bariatric surgery, particularly gastric bypass, patients experience a rapid release of GLP-1 shortly after eating, which is believed to contribute to the procedure's effectiveness in promoting weight loss and improving metabolic health. Both Ozempic and bariatric surgery have been shown to improve various metabolic health markers, including blood sugar control, insulin sensitivity, and lipid profiles. These improvements can help manage or lower the risk of conditions like type 2 diabetes and cardiovascular disease. Ozempic versus Wegovy. Understanding the differences. While Ozempic and Wegovy share the same active ingredient, semaglutide, there are notable differences between these two medications. Understanding these distinctions is crucial for patients and healthcare providers alike. Dosage variations. The primary difference between Ozempic and Wegovy lies in their dosage strengths. Wegovy is typically prescribed at a higher dosage than Ozempic. The maintenance dose for Wegovy is 2.4 mg once weekly, while Ozempic's typical maintenance dose is 1 mg once weekly, with a maximum of 2 mg if needed. This higher dosage of Wegovy may contribute to its potentially greater effectiveness in weight loss compared to Ozempic. Both medications are administered as subcutaneous injections, but their delivery systems differ. Ozempic pens contain multiple doses of the medication, allowing for repeated use. In contrast, Wegovy pens are designed for single use, containing just one dose per pen. FDA approvals for different purposes. The U.S. Food and Drug Administration, FDA, has approved Ozempic and Wegovy for distinct purposes. Ozempic received FDA approval in 2017 for controlling blood sugar in adults with type 2 diabetes mellitus and reducing the risk of major cardiovascular events in adults with type 2 diabetes and heart disease. Wegovy, on the other hand, gained FDA approval in 2021 specifically for chronic weight management. It's indicated for adults with a body mass index, BMI, of 30 kg per square meter or greater, obesity, or adults with a BMI of 27 kg per square meter or greater, overweight, who have at least one weight-related medical condition. In 2024, the FDA expanded Wegovy's approval to include reducing cardiovascular risk in adults with obesity or overweight and established heart disease. It's important to note that while Ozempic has shown effectiveness in weight management, it is not FDA approved for this purpose. Doctors may prescribe it off-label for weight loss, but this use is not officially recognized by regulatory authorities. Insurance coverage disparities. The differences in FDA approvals lead to significant disparities in insurance coverage between Ozempic and Wegovy. Many private insurers and government-funded programs like Medicare and Medicaid typically don't cover these drugs for weight loss, making them financially out of reach for many individuals. For those with private insurance, coverage for Wegovy is more common, with 90% of prescription fills for Wegovy in December 2023 coming from privately insured patients. However, Medicare Part D explicitly excludes weight loss drugs from coverage, although the Centers for Medicare and Medicaid Services announced in March that it would reimburse for Wegovy to prevent heart attacks and strokes. The cost difference between the two medications is substantial. Without insurance, Ozempic costs approximately $935 for a 28-day supply, while Wegovy costs $1,349 for the same period. To help offset these costs, Novo Nordisk, the manufacturer of both drugs, offers savings card programs that can significantly reduce out-of-pocket expenses for eligible patients. Potential benefits and risks of using Ozempic for weight loss. Effectiveness. Ozempic has shown promising results in promoting weight loss, even though it was originally developed to treat type 2 diabetes. Studies have demonstrated that patients treated with semaglutide, the active ingredient in Ozempic, experienced significant weight reduction over an extended period. In a long-term study, participants using semaglutide achieved a mean weight reduction of 10.2% after 208 weeks, compared to only 1.5% in the placebo group. This weight loss was sustained for up to 4 years, indicating the potential long-term effectiveness of Ozempic for weight management. Impact on related health conditions beyond weight loss. Ozempic has demonstrated positive effects on various health conditions associated with obesity. The medication has shown to improve blood sugar control in people with type 2 diabetes and reduce the risk of major cardiovascular events such as heart attack, stroke, or death in adults with type 2 diabetes and known heart disease. Additionally, the use of Ozempic has led to improvements in anthropometric measurements, including reductions in waist circumference and waist-to-height ratio. Common side effects and safety concerns. While Ozempic can be effective for weight loss, it's crucial to consider potential side effects and safety concerns. The most common side effects include gastrointestinal issues such as nausea, vomiting, diarrhea, and abdominal pain. These symptoms are typically mild to moderate and often subside as the body adjusts to the medication. However, more serious side effects, though rare, can occur. These include inflammation of the pancreas, pancreatitis, kidney problems, and an increased risk of thyroid tumors. Patients with a history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2 should not use Ozempic due to the potential risk of thyroid cancer. It's important to note that Ozempic may interact with other medications, particularly those used to manage blood sugar levels. This interaction can potentially lead to hypoglycemia, low blood sugar, especially when combined with sulfonylureas or insulin. Lastly, the long-term effects of using Ozempic for weight loss are still being studied. Some concerns have been raised about the potential for weight regain upon discontinuation of the medication, suggesting that ongoing treatment may be necessary to maintain weight loss. Additionally, the high cost of Ozempic, approximately $1,200 per month, can be a significant barrier for many individuals seeking this treatment option. Conclusion. Ozempic has a significant impact on weight loss and health management, offering a promising option for individuals struggling with obesity and related conditions. Its ability to mimic natural hormones and slow down digestion leads to reduced appetite and improved metabolic health. While it shares similarities with bariatric surgery in some aspects, Ozempic provides a less invasive alternative with considerable effectiveness. As with any medical treatment, it's crucial to weigh the potential benefits against the risks when considering Ozempic for weight loss. While the medication has shown impressive results in clinical trials, it's important to keep in mind the possible side effects and the need for ongoing treatment to maintain weight loss. In the end, the decision to use Ozempic should be made in consultation with a healthcare provider, taking into account individual health needs and circumstances. How quickly can one expect to see results from Ozempic? You may begin to notice a decrease in your blood glucose levels within the first week of starting Ozempic, semaglutide, at the regular maintenance dosage. However, achieving the full benefits can take 8 weeks or more, as Ozempic is a long-acting medication administered once weekly. Are there any risks associated with using Ozempic for weight loss? Ozempic may not be suitable for everyone, particularly those with certain health conditions. It is advisable to avoid using Ozempic for weight loss if you have a history of pancreatitis, other pancreatic issues, or kidney disease. What is the most significant side effect of Ozempic? The most frequently reported side effect of Ozempic is nausea. This side effect was particularly prevalent in clinical trials involving overweight individuals without diabetes, affecting about 20% of participants. Which organs are affected by Ozempic? Ozempic can potentially cause serious side effects impacting various organs. These include inflammation of the pancreas, pancreatitis, vision changes, low blood sugar, hypoglycemia, kidney problems, including kidney failure, severe allergic reactions, and gallbladder issues.